In this video, I carried out an experiment on myself comparing a manual toothbrush versus an Oral-B Ionine versus using the Oral-B Ionine in not a good way. Because you see, my biggest bugbear as a dentist is when patients with great enthusiasm buy an electric toothbrush, but they don't use it properly. So we'll see, is a good manual brusher better than someone who might not be using their electric toothbrush properly? And how does that compare to someone when you do use your electric toothbrush, such as an Oral-B Ionine, using the correct technique? My name is Jazz Galati. I'm a general dentist, and it's my mission to make sure we all level up our oral health. So let's start the experiment. I first used an Oral-B Ionine brush, and I used it in the incorrect way. And I actually did this for 2 days in a row. So 4 times of brushing, night, morning, and I saw the effects this has on how much plaque and bacteria are still left on my teeth when using this amazing brush, but not in the correct way. And this is important because what I want to teach all my patients is that electric toothbrushes are not supposed to be used haphazardly like a manual toothbrush. There's a proper technique to it. But let me show you the kind of sins I was committing on purpose. I was like, think like a patient, think like a patient, think like a patient. So I was trying to think like an average person. So I've seen lots of my patients brush in front of me, and this is how they do it when they do it incorrectly. They are rushing. There is no purposeful brushing. It's all over the place. It's not even on the gum line. I stress so much that the correct positioning of the brush head should be on the gum line where the gum meets the tooth. There's no respect for how much pressure you're putting on. One of the great things about the Oral-B Ionine, it's got a pressure sensor, and you want to see the green light. The green means you're brushing with the correct pressure. And unfortunately, most people are in a massive rush and they only brush for about 40 to 50 seconds, which is a big no-no for obvious reasons. Let me just show you the correct way to brush with an electric toothbrush. So with the Oral-B Ionine, I'll position it for a few seconds over each tooth and covering the front side, which is the cheek side, the chewing surface, and the inner side with the correct pressure. That green light is so helpful. If I see red, I'm pressing too hard. If I see white, I'm not pressing hard enough. So it's a really useful sensor. As you can see, I'm using it in a systematic way. I start on my upper right first, then I move to my upper left, then I do the other 2 quadrants. So you split the mouth into 4 and you make sure you do every single surface. That way you can't miss anything. And of course, you got to brush for the recommended time, which is approximately 2 minutes for most people. All throughout, as well as being systematic, I placed my brush on the gum line. I cannot stress this enough. Now let's compare this to good manual brushing. So I actually did proper manual brushing for 2 minutes, ensuring that my manual brush is actually on the gum line. I'm doing small circular motions and I'm working all the way across. And I covered the entire mouth using this good technique. So let's find out the results. I use a disclosing tablet. So these disclosing tablets are great for showing up plaque that you might miss after brushing. You just chew them and you swirl them around until you can't feel anymore. They're completely edible, they're food grade. And let me show you the results. Let's start with the good manual brusher. So I did 2 minutes of good technique, manual brushing, make sure I get all the gum line, all the way across, small circles, and this is what I got. I actually got a really decent result. There is some plaque. We can see the purple areas, the pink areas are just signs where plaque is stagnating, but it's overall still a fairly good result. But it was very interesting when I compare this to incorrect use of an electric brush. Look at the result of the incorrect use of electric brush using this disclosing tablet. You'll see that they're not very different, i.e. my really purposeful, good quality brushing with a manual was pretty much as good as, or maybe not even as good as, the electric brush for about 40 to 50 seconds in a haphazard way. There's not much difference. We see a little bit of plaque on both, but still, it's not like the teeth are caked in plaque. It's a decent brush. I actually managed to reduce plaque a lot, but you can see a lot of similarities between an excellent manual brusher and an incorrect use of electric toothbrush. Now let's compare both of these techniques to the proper technique of using an Ionine, which is, like I said, a few seconds per tooth. Make sure you're on the gum line and make sure you're systematic with the right pressure. And look at that. You can hardly see much plaque at all. The contrast is quite stark. Now you do see a little bit of purple in between the teeth. This is where your floss or your interdental brushes comes in. But all in all, we can see a near perfect result by using the Oral-B Ionine with good proper technique. Now we know already that a manual brush only removes 50% of the plaque, and with the Oral-B Ionine you can get all of it. And a brush like an Oral-B Ionine is much more effective. Now this was me, a dentist, using really good manual technique. Most of my patients aren't excellent brushes, so you can see the real benefit of where the electric toothbrush comes in. Even if you're using, and I don't want anyone to use this, but even if you're using poor technique with the electric toothbrush. Remember, with the electric toothbrush, you want to be purposeful, systematic. You kind of want to be lazy. You want to let the brush head do all the work for you. There's like hundreds of patents in this magic brush, and you want to let all the micro vibrations do all the work for you. So just a few seconds per tooth and you work it around and it does everything. You don't need to move it around haphazardly. So you can see from my experiment that an Oral-B Ionine removes more plaque than a manual toothbrush, even though I tried really hard with a manual toothbrush. And hopefully you've learned about the correct technique with an electric toothbrush. Let the brush do the work for you and you can see how good a result you can get with an Oral-B Ionine. And this is all really important because biofilm, or the plaque, that sticky bacteria on your teeth, is the enemy. It's responsible for gum disease, tooth decay, and there's a huge link to our overall health, like linked to heart disease and diabetes and our overall well-being. So it's a great reason now more than ever to get an Oral-B Ionine, which is on amazing deals at the moment for Black Friday and Cyber Monday. So if you've been sat on the fence for a while, now is the time to get rid of that manual toothbrush, switch to the best electric toothbrush there is, the Oral-B Ionine, and now you can even use it in the correct way. I hope you find that video useful. Check out the links below.